I mean, you look at someone and they're the spitting image of fitness. They're eating right, they're sleeping right, they're training. That's what everyone should do. And if everyone did that, generally the world would be a better place, but it doesn't make you immune to heart disease. We know that that's just not true.
I actually started lifting weights when I was 16, believe it or not. Lifting weights and being in the gym taught me about taking care of myself in a way that I never imagined. It helped with my mental health, my stress level, and it just ended up becoming such an important part of my life. May 21st, 2023, my kids are watching cartoons, and I was standing in my kitchen making coffee, and all of a sudden this pressure that was in my heart turned to excruciating pain. The room started spinning. I couldn't breathe. Within minutes, there was full medical staff personnel. But I think back in that moment, and what's really interesting is even then, my heart wasn't one of the first things they were thinking was wrong.
When I was an internal medicine resident, I remember seeing patients who were young women presenting with heart attacks, being told that all their testing was normal, and having them continue to have the question, what exactly happened to me? And will this happen again? And we actually did not have great answers.
The Women's Heart Health Program started in 2007 with the support of the Corrigan-Minahan family. So, we're one of the largest and probably one of the oldest programs of its kind in the nation. And really, it was cardiology had been treating women like little men. And then I think we realized when more women died of cardiovascular disease than men, that we probably should be thinking about women a little bit differently and figuring out what the actual sex-specific differences are.
When I was on the operating room table, I heard him say, "We found something. There's a tear in your heart. It's called spontaneous coronary artery dissection, SCAD. You've had a heart attack." And I could not believe it.
It's a heart attack the same way somebody might have a heart attack if they had plaque buildup in the artery, but the mechanism of the blocked artery is different, and so the treatment is different.
I went from being in the gym lifting 500 pounds to barely being able to walk up a flight of stairs without being out of breath, and was told in those moments that my lifestyle that I knew that was comfortable, that was mine, was no longer mine. And it was just absolutely devastating. I became very depressed. I felt like I lost my purpose in life.
It is devastating. You lose your identity. And to the extent that we can use the science of exercise and cardiovascular science to restore that identity, I think that's real healing.
We walked into Mass General, that appointment, my mother and I. I instantly felt at ease. I looked at my mom and I'm like, this is where I'm supposed to be. And when I found they had a SCAD clinic, I was ecstatic.
We started the Sports SCAD Clinic just this past year in 2024. And it was with the idea that we wanted women to be able to get back to their athletics and their exercise and their usual activities after a SCAD. So we joined forces with our sports cardiology program led by Dr. Sawala Gusa. So by identifying their exercise capacity and where we think their sort of anaerobic threshold is, we're able to kind of tailor exercise recommendations for them. And what we're hoping to show is by using this exercise guidance, that exercise after SCAD is safe.
This really was born out of really just organic conversation that I think happens so naturally at Mass General, where you have colleagues and friends who are interested and true experts in their content and being able to see where can we leverage the expertise in a way that can improve patients' lives and experience.
It's been so rewarding to see Tara's journey. She's found ways to put her energy into other things and to be such an important advocate for SCAD and for women's heart health in general.
Mass General is life-changing. They truly take a collaborative approach to helping patients like me, and that if it wasn't for them, I truly don't feel as though I would be in the position I am today, which is thriving.
You can't do this work without having the support. There's no way we could have done any of this without the help of philanthropy, because it really makes the possibilities that we think of into a reality.
In addition to the phenomenal training that happens here and the focus on taking care of the patient in front of us, it is a unique place in that it is thinking about the patient that's going to come in a decade from now, 2 decades from now. That is why we invest in cardiovascular science. It's because we know that, the care that we give today, if we're still giving that care 10 years from now, it's inadequate. That is at the core, I think, of this place. It's about, hey, can we give the best care today? And we know that giving the best care tomorrow requires us to think about how are we going to do this better.